Ageism plays a factor into the well-being and care of elderly people. Many elderly people will be subjected to different forms of abuse, whether it be from their families, medical staff, or caregivers.
I definitely think ageism has a factor in the treatment of patients. I think it's a bit more regional and more based on rural versus a large city, probably more prominent in larger areas. I guess the biggest place I would see it is in the patients chronically in the hospital for long periods of time. It's not uncommon, and it's easy for physicians to decrease the amount of rounding and following up with these patients because they've been in there for so many weeks, so many days, so many months, and kind of easy to get pushed aside to the younger, more acute patient.
The longer any patient remains in the hospital, the more they risk being subjected to neglect. While anyone can experience this, it is more commonly experienced by elderly people.
I think some elderly people are less likely to receive the medical attention they deserve and need. This is most common probably in chronic long-term conditions. Atherosclerosis, diabetes is a very big one. Patients with Parkinson's, Alzheimer's, chronically hospitalized or in long-term care may not be seen as quickly and as often as a mobile younger patient that can make it to the doctor's office easier and more often than an elderly patient, especially maybe a patient that's elderly, that's wheelchair bound, walker bound, maybe someone with some cognitive deficits, especially mental deficits, can't answer questions appropriately, decreased ability to talk and function. So definitely their amount of care may be definitely decreased.
In medical environments, elderly people struggle to receive the attention and care they need. As people age, they develop more medical problems, which leads to the need for more treatments. While these treatments are typically available, oftentimes they are not properly conducted. These misconducts are often linked to neglect in patients and are more commonly occurring with elderly patients. Elderly patients are often viewed as lesser or more of a hassle compared to younger ones.
To witnessing inequalities, I think for sure most physicians, especially in their training, because you got to train in a bigger hospital, have witnessed this. Perfect example was my training dealt with quite a bit of VA hospitals. I was in the military myself, so I really respect that, but the 3, maybe 4 VA hospitals I worked at, a lot of the vets, the care was substandard. You may not round on these guys. Should be daily. You may not do it but every 3rd day. A lot of times the nurses are basically taking care of these guys. Even currently, where I currently live, the VA system is around here, and an example would be in the civilian world. If you need an MRI, somebody orders an MRI of a knee or of the lumbar spine, it's done within 1 to 2 weeks. For the VA system, it may be 6 to 8 to 10 to 12 weeks before that MRI is even completed, despite symptoms, severe pain, or a recent injury or anything.
It is not uncommon for elderly people to face longer waiting times for test results or treatments. This is usually a factor of medical professional putting the care of younger patients before elderly ones. This practice isn't uncommon and has resulted in elderly patients suffering for longer than need be. Treatments are often prolonged in order to manage a younger person's health over an elderly person's. This practice is unjust and inhumane, but nevertheless continues, and ageism remains a prominent factor in the medical field.